Hello, my name is Zach Harris, and today I will be presenting on herpes simplex virus. Herpes simplex virus is a member of the herpes virus family. There are two different kinds of herpes simplex virus, HSV1 and HSV2. HSV1 is the strain that causes oral herpes. HSV2 is the strain that causes genital herpes. Both types of infections are lifelong diseases. Between the two types, HSV1 is the most common. Herpes simplex virus is very common and widespread around the world. Worldwide, around 90% of people have at least one of the strains, either HSV1 or HSV2. There are around 358 million people living with oral HSV1 and between 122 and 192 million people living with genital HSV1. Over 490 million people are currently living with HSV2. As far as genital infection goes, there are between 596 and 656 million people infected with either HSV1 or HSV2. Herpes simplex virus is not just a developing country problem either. In the United States and Europe, around 65% of people are seropositive for HSV1. This means that 65% of people have HSV1 even if it is in a latency phase. While herpes simplex virus is common everywhere, it is almost universal in developing countries, meaning that almost all people in developing countries have HSV1. HSV2 is also very common in developing countries, as some African populations have over a 50% prevalence. As you increase in age groups, the rate of herpes simplex virus increases. This means that older populations have a greater incidence of herpes simplex virus than younger populations. It has also been seen that women have a greater risk for contracting HSV2 than men. As far as pathophysiology goes, herpes simplex virus infects someone when it comes into contact with mucosal surfaces or scraped or abraded skin. The virus then replicates at the site of its infection. While the virus is replicating at the site of infection, either an intact virion or a capsid is transported by a neuron to the dorsal root ganglia. After another round of replication occurs, latency is established. Infection of HSV1 usually occurs in the oropharyngeal mucosa, and latency occurs in the trigeminal ganglion. Infection of HSV2 usually occurs through genital contact and establishes latency in the sacral ganglion. The more severe that the primary infection is, the more likely it is that the person will experience reoccurrence. Once latency has been established, a stimulus is able to cause reactivation. Most reactivation cases of both oral and genital herpes are asymptomatic. The silent excretion of virus by healthy, previously infected individuals occurs on about 1% of days for children and between 5 and 10% of days for adults. Reactivation usually occurs in association with a fever, exposure to ultraviolet radiation or wind, nonspecific stresses, manipulation of the trigeminal nerve, or dental extractions. Symptoms of HSV1 include painful blisters or ulcers that occur in and around the mouth. The sores that will present on the lips are commonly known as cold sores. When infected with HSV1, a person will also likely experience tingling, burning, or itching around their mouth before the cold sores appear. Symptoms of HSV2 include genital and anal blisters or ulcers. When someone becomes infected with HSV2, they can experience a fever, body aches, or swollen lymph nodes. Diagnosis of herpes simplex virus can often be done solely based on appearance. Herpes simplex virus can also be diagnosed using DNA tests and virus cultures. There's no cure for either strain of the herpes simplex virus, but treatment can help to relieve symptoms of the disease. Medications are able to help relieve pain during the reoccurrence and can also help reduce healing time. Using medication can also help reduce the total number of reoccurrences a person will experience. Some drugs that are commonly used to treat herpes simplex virus are Famvir, Zovirax, and Valtrex. Some home remedies can help soothe symptoms. For example, warm bath salts can help to reduce pain from genital sores. Herpes simplex virus is usually not a life-threatening disease In order to avoid transmission of the disease, infected people should refrain from sex when they have an open sore on their sex organs. Using latex condoms during sex can also help prevent the spread of herpes simplex virus, as well as limiting the total number of sex partners someone has. Herpes was a big topic in society for a long time, with hysteria reaching its peak in the 1970s and 80s. In the 1980s, there was a Time magazine headline titled Herpes, the New Sexual Leprosy. This exemplifies the way that herpes was viewed in American society. In 1982, the first treatment for herpes simplex virus was established. This started society on the track to realizing that HSV was something that could be lived with and controlled. In conclusion, herpes simplex virus is an extremely common disease among all populations, although it is more prevalent in developing countries. As far as HSV-1 is concerned, most infections occur during childhood, but because HSV has latency, many people have the disease and do not even know it. The spread of HSV is able to be controlled by using safe sex practices. Since HSV is much harder to spread when there are no symptoms showing, it's easier to control the spread. While herpes simplex virus is not deadly, HSV-2 can increase a person's risk for developing HIV, which could potentially be deadly. There's currently no cure for herpes simplex virus, but medications can be used to help reduce the symptoms and discomfort of the disease. So one question I got asked was if someone has contracted HSV-1, can it mutate to HSV-2 over time? The answer to this is that while HSV-1 can infect the genitals, it cannot mutate into HSV-2. Another question I got asked was if most people with HSV-2 took daily medications or if they just took medications when needed. Some people choose to only take medications during outbreaks, but, but people who choose to take a daily antiviral medication can have little to no outbreaks at all. The third question I was asked was if a person had to be having an active flare up in order to transmit the virus. Herpes simplex virus can be transmitted when the host is asymptomatic. This is far less likely than transmission during a flare up.